So at each stage, you're going to be thinking about commercialization, and the companies that exit really well and the companies that go past this commercialization phase are the ones that are thinking about this at the early stages, right? And how are they working it into their process and their workflow and their organization early. The better you are at completing these or articulating these or figuring out the buckets on the left-hand side earlier, the easier things are going to be down the road when you do try to commercialize or when you do try to actually get payment for your new technology. When you're thinking about that roadmap for finances or for just development in general, like weaving in this piece of we're going to need X amount in order to do this the right way. And I think it's important to talk to your investors about these two tracks, right? And talk about, hey, this is an important concept for, and maybe something that's different in healthcare, right? Versus another, other industries. Okay, so the first one here is this product concept and market analysis. And this is where typically, right, you're building your MVP product, you're understanding what the clinical needs are, you're understanding what the indication might look like. And then from a commercial side of things, you are thinking about opportunity assessment. You're looking at you're giving your initial competitive review. What is your KOL plan? I think a lot of teams will gather the KOLs in order to get inputs on their product concept, but also we should start thinking about how these KOLs will help us build a community of other physicians and other KOLs 5 years from now, right? So are these the guys that are going to be able to stand up on podium and talk about key issues? Are they going to be the ones who are going to stand behind us, at the end of the road and not just give instructions on a new innovation, right? You want to reverse that process where you should be heading into your clinical trials with an understanding of what you want to get out, not just from a product performance standpoint, but also from a pricing standpoint, from a patient standpoint. What are the claims we want to make in our marketing materials before we go to clinical? Reimbursement, obviously we want to talk about more about like the workflows. Is there any real world studies we can be doing now? Is there any bench data that we want to sort of start promoting and getting the reimbursement and the pricing side of things started? Messaging, we talk about value prop is not only the value prop in the sense of jobs to be done, right?